Hello dear students, welcome to NEET PG 2024 recall session by Manipal MedAce. I am Dr. Vidya Gowda, your community medicine SME. So this year the exam happened in 2 shifts and there were questions from various topics, right? I have listed on the topics here. There were questions from concept of health and disease, HDI and PQLI was asked, epidemiology, case control study, the steps, and also infectious disease epidemiology, some definitions were asked. Statistics, there were questions, some 4 to 5. Epidemiology of communicable diseases, there were questions. National health programs, disaster management, demographic cycle, MMR and ENMR. What is ENMR? Early neonatal mortality rate calculation was asked. Nutrition, there were questions. Vaccines, like every year, this year also there were questions from vaccines topic, and also entomology. So these were the topics which were given importance in this particular exam. So let us solve the question one by one now. So let us take statistics first. What was the first question in statistics? Calculate the median for the following values. So the values were 8 in number, right? Even number. The values were like this: 2, 3, 4, 4, 5, 6, 7, 8. So what is median first of all? So when you arrange the data into ascending or descending order, the middle value is your median. What does mean? Median is nothing but the average of all the values. What is mode? Mode is the most recurring value, right? So here they asked median. So median is the middle value. In this question, there were even numbers. So what are you supposed to do? You're supposed to take the middle 2 values and sum it and divide it by 2, right? Divide it by 2. So what is the answer for this? It is 4.5, right? So if you add 4 plus 5 and divide it by 2, what is the answer you get? It is 4.5. So I hope you've correctly marked this. It is a very simple question and we have discussed this many times in our videos. Moving on to the next question from statistics. A researcher is studying the effect of a new diet on cholesterol levels. The cholesterol levels of 84 patients were measured before and after following the diet, before and after few months, right? So what is a keyword here which you should look for? Before and after, right? Pre and post. The researcher wants to determine if there is statistically significant difference in the mean cholesterol levels. So now this is the second keyword for me, mean cholesterol levels. Again, before and after the treatment. Which statistical test should the researcher use? So this was the question from statistics. So this is from tests of significance topic. Again, we have discussed this in our videos and also I have made a 1-minute reel on this, right? So independent t-test. So when do you use independent t-test? Let us rule out the options one by one and arrive at the answer. So what is independent t-test and where is it used? So when you're testing the mean cholesterol levels on the same group of subjects, you're going to use independent t-test or unpaired t-test. But here they have mentioned before and after. That means you have paired data. So that is why you're supposed to use paired t-test, right? So this is the correct answer. So when do you use ANOVA? When there are more than 2 groups, right? 3 or more than 3. So that is when you use ANOVA, when you are finding out the difference in the mean levels of 3 different groups. Then you can use ANOVA. So when you use chi-square test to test the association, right? So independent t-test is used for unpaired samples. Nothing but on the same group of subjects you have you have some values. That is when you use independent t-test. ANOVA is to compare 3 different groups, right? 3 or more than 3. Chi-square is to test the association. So the correct answer for this question would be paired t-test. So the keywords which you should look for in this particular question is before and after and mean cholesterol levels, right? So if it is not mentioned that it is mean cholesterol, if it is in the form of scores, then it becomes a non-parametric test because it is not normally distributed. So then what test are you going to use? If it is, if the data is normally distributed, the counterpart of paired t-test, it is Wilcoxon sign rank test. And the counterpart of unpaired t-test is Mann-Whitney's test. I hope you remember this. Moving on to the next question from statistics again. A researcher wants to study dietary habits and divides the population into groups based on religion before randomly selecting individuals from each group. So what sampling technique is this? Again, we have discussed the sampling techniques in our videos. So four options they've given here. One is simple random sampling, stratified sampling, cluster sampling, systematic sampling, right? So what is the best answer for this? The investigator is dividing the population into different groups, and from each group is selecting a certain set of individuals. So that is dividing the population into different strata. So what is the answer here? Stratified sampling technique, right? So the best answer for this is stratified sampling technique. So simple random sampling technique, you're already familiar with it. What is cluster sampling? It is used while evaluating the immunization coverage, right? The WHO evaluation of immunization coverage, we use cluster sampling. Systematic sampling is we calculate the fixed interval, and for example, if the fixed interval is 5, every fifth house will be selected. So that is how it is done in case of systematic sampling technique. So the best answer or the correct answer for this particular question is stratified sampling technique, because the investigator has divided the population into different strata. Moving on to the next question, which is again from statistics. As you can see, every year there'll be more questions, right, from statistics. This year also, there are at least 4 questions from statistics. A researcher wants to investigate whether there is an association between smoking status and the presence of a particular health condition in a sample of adults. So smoking status, yes or no, that is smoker or not smoker. Similarly, presence of a particular health condition, present or absent, all right, it's binomial in a sample of adults. What is the most appropriate test that can be used here? Okay, what are the keywords here again? Association. So the keyword which you should be looking for is association. So here the investigator is testing whether there is an association between two different variables, independent variable and a dependent variable. So what is the best answer for this? So let us start from option D. So ANOVA, we've already discussed this. ANOVA is to test the difference between 3 different groups, right, or more than 3 different groups, and you're testing the difference between the means. It is used for parametric data, that is normally distributed data. So what is Pearson correlation coefficient? When do you use Pearson correlation coefficient? So when you're trying to find out whether there is a relationship between 2 quantitative variables. For example, with increase in height, weight also increases. Weight and height here are quantitative variables. They both are measurable. So in such cases, you're going to use Pearson correlation coefficient. Again, it is used when the data is normally distributed. What is a counterpart if it is not normally distributed? It is Spearman's correlation coefficient, right? If the data is not normally distributed and if you are trying to find out if they are related or not, you're going to use Spearman's. If it is quantitative in nature, normally distributed, you're going to use Pearson correlation coefficient. T-test for independent samples. Again, we've discussed this. So this is nothing but unpaired t-test or student t-test. When you're finding out if there is any difference in the mean levels on the same group of subjects, you're going to use t-test. This is for unpaired data. So the best answer for this question would be chi-square test, because in chi-square, you measure the association, right? You test whether there is an association or not. Moving on to the next topic, that is national health programs, right? So in this, they've given an image and they've asked you to identify the logo. So is it leprosy eradication program, national tuberculosis elimination program, national vector-borne disease control program, or national rural health mission? So what have you all marked for this? Again, we've discussed this in the videos, right? While discussing the programs, I've given the images for all the programs. So this particular image is leprosy eradication program. Okay, so the best answer, the correct answer for this particular question is National Leprosy Eradication Program. So if you look at the names, you can see what stage the program is in. So leprosy we've already eliminated, so we are in the phase of eradication, right? And then tuberculosis we are trying to eliminate. If you take vector-borne disease, it is in the control phase, okay? And then National Rural Health Mission is a mission, right? So this is how you should understand. So this particular images or logo is National Leprosy Eradication Program. So let us have a look at the logos of tuberculosis program, National Vector-Borne Disease Control Program, and NRHM. So this is the logo for National Tuberculosis Elimination Program. and this is for NVB-DCP, right? National Vector-Borne Disease Control Program, and this is National Rural Health Mission. Okay, so these are the images or logos you should remember. Moving on to the next question. Again, this is from National Health Programs. Which of the following is the correct full form of JSSK? So this year they've not asked what are the services under JSSK. So they've asked the full form of JSSK, which is very, very simple. All right. So is it Janani Shishu Suraksha Kendra, Janani Shishu Suraksha Karyakrama, Janani Shishu Swasthya Kendra, Janani Shishu Swasthya Karyakrama? Options are very carefully designed so that they can confuse you, but I'm sure you've all marked it correctly because we've discussed this. So the best or the correct answer is Janani Shishu Suraksha Karyakrama. All right. So this is one of the schemes under RCH. So what do we do under JSSK? What are the benefits? If you remember, there are 4 Ds, right? Okay. Delivery is free, drugs, diagnostics and diet is free for the mothers post delivery. Diet, drugs, delivery and also diagnostics. Along with this, free transportation and also blood transfusion. So these services are also given free of cost. Along with this, there is one more service for the infants, right? Especially sick infants. Up to 30 days, free of cost services are given for the sick newborn infants. So these are all the services under JSSK scheme, right? 30 days free stay at the hospital along with all these services. So even if you didn't know all these services which are provided under JSSK, if you knew the full form, you would have marked it correctly. Moving on to the next question, which is again from National Health Programs, right? Which of the following programs uses image like this, the one shown in the picture, to create awareness? So let us look at the image here. There is a small girl carrying a bag. So it looks like a school-going girl, right? So which disease does this image represent, or which against which disease is this girl creating awareness, right? So is it HIV, leprosy, breast cancer or diabetes? So the first 2 options I got it correctly, and last 2 options I've just added because I couldn't get the options. So the best answer for this is Sapna leprosy, right? So this girl is called as Sapna. She's a school-going girl. She's been suffered from leprosy, cured of leprosy, but she's spreading the awareness so that she can prevent the spread of leprosy in the community, right? That's what she's doing. She's creating awareness. So Buladi is for HIV/AIDS. Here, how to differentiate Sapna from Buladi? Here, the lady is there and the lady is wearing a red ribbon, right? This is a small girl, whereas in case of Buladi, there is a lady wearing a red ribbon. Okay, so these 2 are confusing. Buladi and Sapna. Breast cancer and diabetes you could easily rule out, but these 2 are the options which are confusing. So the correct answer for this is Sapna. This is creating awareness regarding leprosy. Moving on to the next question. Again, this is from National Health Programs. Ayushman Bharat. Okay, this is a school health program. What they've asked: which of the following is not a component of school health program under Ayushman Bharat program? Okay, so this was very tricky, very simple it looks, but it is a tricky question. Sanitary napkins, health screening, deworming, IFA supplementation, iron and folic acid supplementation monthly. Okay, so what have you marked for this? Sanitary napkins are given for school-going girls under Ayushman Bharat program. We all know this. Health screening is of course done. Health screening you can easily rule out because it is done under all the programs. Deworming, again, it is done, right? So deworming is also done. Health screening is also done. Sanitary napkins is also given. So what about this iron and folic acid supplementation? Is it done or not under school health program, which is under Ayushman Bharat? Of course it is done. Without IFA supplementation, no program is complete. Anemia is so prevalent in our country, we have to supplement everybody with iron and folic acid tablets. But this is the correct answer. The reason is they've mentioned IFA supplementation monthly. It is not monthly, it is weekly. So that is the only thing you have to remember to answer this question. Okay, so some of the students have messaged me and they've asked me, ma'am, all the options are correct because napkins are also given, screening is also done, deworming is also done, and IFA supplementation is also done. So if we mark any option, will we get the marks? So it's no, because they've asked monthly. So that is wrong. It is weekly. So if you remember, it is WIFS, right? Weekly iron folic acid supplementation. Okay, so the correct answer for this question is iron and folic acid supplementation monthly. Okay. And one more thing is, they've mentioned not. So this also you should not miss. Okay. So this is about programs. Moving on to RCH, that is reproductive and child health. What term refers to number of maternal deaths during a specific time period per population of women of reproductive age? Again, we've discussed this in our videos. So maternal mortality rate, maternal mortality ratio, crude birth rate, and crude death rate. So what is the correct option for this? So you can easily rule out crude birth rate and crude death rate. So crude birth rate is number of births per 1000 media population. Similarly, crude death rate is in the numerator you have number of deaths, and in the denominator you have media population multiplied by 1000. So these two you can easily rule out. So the options which are confusing are maternal mortality rate, maternal mortality ratio. So in case of maternal mortality, we use both rate and ratio. So you should know what is a rate and what is a ratio to answer this question correctly. So what is a rate? In this, numerator is a part of denominator. What is a ratio? Numerator and denominator are two different entities. So what is the correct answer here? So what is the numerator? Number of maternal deaths, right? Number of maternal deaths is the numerator. In the denominator, population of women of reproductive age group. So women of reproductive age group. So number of maternal deaths, is it a part of women of reproductive age? Of course, yes. So this becomes a rate. So the correct answer for this question is maternal mortality rate. All right. So what is maternal mortality ratio then? So we have discussed both of these indicators in our videos. So maternal mortality ratio is number of maternal deaths in the numerator. That is correct. I mean, that is the same. In the denominator, you have number of live births, right? So your numerator and denominator are two different entities. So it becomes a ratio. So the correct answer for this is maternal mortality rate. All right. So I hope you marked this correctly as well. Moving on to the next question, maternal mortality ratio calculation. I think this was asked in the second shift. A village consists of 30,000 population. The number of live births is 4,000. All right. So we are calculating ratio and they have given number of live births. Number of deaths among the mothers is 6. Okay, number of deaths is 6 among the mothers. The causes of deaths are as follows. What is the maternal mortality ratio? Right, ratio. There is a death due to snake bite. So do you include this as a maternal death? No, right? RTA, that is road traffic accident. This is also no. If you take abortion, this is one of the causes of maternal mortality. Sepsis, of course, yes. PPH, placenta previa. So all these are considered as causes of maternal mortality. So these 4 causes should be taken. These 4 deaths should be considered while calculating maternal mortality ratio. So in the numerator, what do you have? Simple calculations only they'll give you. They won't give you calculations which will make you use calculators and all, because that is not allowed. So simple calculations only they'll give you. But looking at the question, we should not get scared thinking there is like there are too many numbers, we won't be able to calculate, let us move to the next question. So we should not do that. They always give you simple calculations, right? In the numerator you put 4 and in the denominator you put 4,000, right? Because the live births is 4,000 and you express it in terms of lakh, right? Yeah. So what is the answer? 100. Okay. Numbers may be different here because this is given by one of the students. Numbers may be different, but you should understand the concept. Okay. In the numerator, deaths due to deaths which are directly related to maternal mortality, and in the denominator, live births. Okay, multiplied by 1 lakh. So the answer is 100. So 4 options had been given: 100, 150, 200, and 250. So what is the correct answer for this? 100. I hope you marked this correctly. So moving on to the next question, which is again from RCH, that is reproductive and child health. Early neonatal mortality rate calculation. Again, for this question, I could not get the exact values, but of course, if we understand the concept, we can solve the question. In a community, there were 10 stillbirths, 8 deaths within the first 7 days of life, 5 deaths between 7 and 28 days over a 1 year period. The total number of live births during the same period was 1000. What is the early neonatal mortality rate for this community? So again, we have discussed this concept in our videos, right? What is early neonatal mortality? What is perinatal mortality rate? What is post-neonatal mortality rate? What is infant mortality rate? Of course, we have not discussed the same question. The concept we've discussed. So if you take stillbirths, do you include stillbirths in early neonatal mortality rate calculation? The answer is no. Stillbirths you take into account while calculating perinatal mortality rate. So what is early neonatal mortality? What is this period? Early neonate. 0 to 7 days is early neonatal period. I hope you all remember this. 7 to 28 days is post neonatal. So 0 to 28 days becomes neonatal period, right? So the neonatal period is divided into two different time periods. 0 to 7 days is early neonatal period and 7 to 28 days is post neonatal period, right? So 0 to 1 year is infancy. Okay, so this is how you calculate infant mortality rate. This period you consider while calculating infant mortality rate. So the question what they've asked is early neonatal mortality rate. So you should look for the deaths which have happened between 0 to 7 days. So 8 deaths within the first 7 days of life and 5 deaths between 7 to 28 days. So 7 to 28 days we are not including. We are including only these 8 deaths which happened within the first 7 days of life. Okay, so that's all you need to understand. Early neonatal period, 8 deaths had happened and you need to express it per 1000 live births. So the correct answer for this is 8 per 1000 live births. I hope you marked this correctly. So moving on to the next topic, which is nutrition. Again, nutrition is given very much importance in all kinds of exams. So here that given an image, all right, and the question was like this. I'm not sure about the question, but the image one of you had shared with me. A 1.5-year-old female child presents to a primary health center with dry conjunctiva. On examination, the following finding is observed. What is the most appropriate dosage of vitamin A supplementation? So I'm not sure whether they'd asked about the dosage of vitamin A supplementation or they'd asked to identify this particular image. Right, anyways, let us understand the concept. So this particular image is showing white dot spot. So it is a feature of vitamin A deficiency. So the child is already suffering from vitamin A deficiency, right? Vitamin A deficiency. So we need to supplement with vitamin A. So what is the dosage and how many doses do we give? So again, we had discussed this. So if the child is less than 1 year, we give 1 lakh international units. If the child is more than 1 year, we give 2 lakh international units. Okay, so the child is more than 1 year. So the first two options will be ruled out here. So let us look at option 3 and option 4. That is 2 lakh international units, 2 doses, or 2 lakh international units, 3 doses. So correct answer for this is D, right? Option D. So you give 2 lakh international units, 3 doses. Today you give 1 dose if the child has come to you today. Tomorrow, that is 24 hours later, you're going to give the second dose, and 2 weeks later you're going to give the third dose. So totally it becomes 3 doses. If the child is not suffering from vitamin A deficiency, prophylactically what do you give? Starting from 9th month till 5 years, every 6 months you give 1 dose of vitamin A prophylaxis, right? And the image, of course, you know it is white dot spot. Okay. Moving on to the next question. Again, this is from nutrition. Again, this is given a lot of importance, this particular topic, and it is a repeat. Okay, a chronic maize eater presents with diarrhea, dermatitis, and dementia. Right, 3 classical features, 3 Ds, that is diarrhea, dermatitis, and dementia. What enzyme deficiency is likely responsible for these symptoms? Riboflavin, thiamine, biotin, and niacin. Okay, I don't have to discuss this because it's a repeat. So the correct answer for this is niacin deficiency, right? I hope you have marked this correctly. Moving on to the next topic, communication and health education. Again, this topic is given a lot of importance. So this year there were 2 questions, right? Shift 1 there was 1 question, and shift 2 also there was 1 question from this particular topic. Difference in interpreting the meaning of words in a message. Okay, there is difference in interpretation of the meaning of the words in a message. Okay, this has led to a particular barrier. And what type of barrier is this? This is the question which has been asked this particular year. Is it linguistic, semantic, cultural, and psychological. So let us understand all of these barriers, right, of communication. So what is linguistic barrier? For example, my mother tongue is Kannada. I go to a different state, let us say Kerala, and I'm trying to give health education regarding HIV. So I'm using Kannada there, but they are not able to understand, and I'm not able to teach in their language. So this becomes linguistic language barrier. All right. So that is not the correct option here. So what is cultural barrier? Okay, so again, cultural barrier is we should understand the cultural beliefs. For example, if I'm talking about importance of vitamin B12 supplementation, and if I'm talking about food items, I cannot be talking about consumption of meat to a vegetarian community, right? I need to understand their culture. So what is psychological barrier? So if the audience or the speaker, they have anxiety issues or stress issues, so the reception of the message will be difficult. Okay, so the correct answer for this is semantic. So what is semantic barrier? The audience or the people are not able to interpret the meaning of the words which we are trying to communicate. So that is the correct answer for this particular question. So it is semantic barrier. All right. Moving on to the next question from Communication and Health Education chapter. Which of the following correctly represents the steps in the motivation model? So they've asked the order. All right. So this was shared with me by one of the students. What is the correct order? So there are 4 options here. So the correct order is awareness, right? First we create awareness. For example, if you are talking about hazards of smoking, we are going to create awareness first, right? We're going to impart knowledge and create awareness. When we create awareness, they get motivated to stop smoking, right? The second step is motivation. Okay, after this there is an action stage. They will stop smoking. Okay, so this is the correct order in motivation model: awareness, motivation, and action. So the correct answer is option C. Moving on to the next topic, which is communicable diseases. Again, this year a lot of importance was given to infectious disease epidemiology topic. So now the questions was like this: in which of the following diseases is the iceberg phenomenon most pronounced, where a large number of cases remain subclinical or undiagnosed? So we all know what is iceberg phenomena. The tip of the iceberg represents only the clinical cases, symptomatic cases. The large portion of it is submerged, right? So it represents subclinical, undiagnosed, inapparent cases, right? So which of the following diseases it is most pronounced? So that is a question asked. So what are the options given? Tetanus, rabies, influenza, varicella. So here I'll easily rule out tetanus and rabies, because tetanus and rabies, they do not show iceberg phenomena. There are no subclinical cases, right? There are 3 diseases in which there are no subclinical cases. One is tetanus, rabies, and the other one is measles, right? So measles also, there are no subclinical cases. So MTR, in these 3 diseases, there are no subclinical cases, so there is no iceberg phenomena. So the options which are confusing are influenza and varicella or chickenpox. So influenza, what is the subclinical cases proportion, and varicella, what is the subclinical cases proportion? That is what we need to know to answer this particular question. So influenza, it can be around 50 to 70%, whereas varicella, it is around 7 to 10%. Okay, so what is the correct answer for this particular question? Influenza. Okay, so in case of influenza, you see a lot of subclinical cases. So the correct answer is influenza. Moving on to the next question. This is malaria treatment. Again, we have discussed this under NVB-DCP program. According to NVB-DCP, so what is NVB-DCP? National Vector-Borne Disease Control Program guidelines in India. The treatment for a patient with a co-infection of Plasmodium vivax and Plasmodium falciparum is. All right, options were 4. I've just written 3 lengthy options. They were, that's why. So this particular person is suffering from mixed infection. So what are we going to do? We are supposed to treat him both for falciparum as well as vivax. So what is the regimen? ACT-SP, right? What is ACT? Artesunate combination therapy, and SP, sulfadoxine and pyrimethamine. All right. This is in all the states, but ACT-AL, okay, that is in northeastern states. Okay, and also you give Primaquine because there is vivax infection also. So what is the dosage? Artesunate is 4 mg per kg body weight. Sulfadoxine is 25 milligrams per kg body weight. And pyrimethamine is 125 milligrams per kg body weight. You also give primaquine, that is 0.25 milligrams per kg body weight for 14 days. Alright, see, other options were wrong. Okay, so the correct answer for this is ACT-SP for 3 days and primaquine for 14 days. So the dosage is also mentioned here. I hope you have marked this correctly. Moving on to the next question, which is again from communicable disease. A child with diphtheria as an exposed sibling who is fully vaccinated. What is the recommended drug of choice for prophylaxis in this exposed sibling? Okay, so there is a family and there are two children. One child is suffering from diphtheria, but the other child is vaccinated. But still, you should give an antibiotic to prevent the spread of diphtheria. So, what is the drug of choice for prophylaxis? Penicillin, tetracycline. What is the drug of choice? These two are the wrong options, tetanus booster and diphtheria antitoxin. Is it penicillin or tetracycline? So the correct answer is penicillin. So what is the drug of choice for prophylaxis in case of diphtheria? It is erythromycin. Okay, erythromycin is the drug of choice. If erythromycin is not there in the options, you can mark penicillin as well, because penicillin also can be used. Okay, so the correct answer is penicillin. Moving on to indicators of health. This is from Concept of Health and Disease chapter. Students prepared a report using GNP, mean years of schooling, and life expectancy at birth as indicators. So the students have prepared a report using 3 different indicators. Okay, what are the indicators? GNP, that is income, mean years of schooling is nothing but knowledge, and life expectancy at birth. Alright, what is a composite measure commonly known as? Is it physical quality of life index, human development index, economic development index, human poverty index? So let us look at these 4 options. So what is human development index? It is mean years of schooling, that is knowledge, GNP, income, life expectancy at birth. Okay, so they are taking life expectancy at birth. If you take PQLI, that is physical quality of life index, infant mortality rate, life expectancy at the age of 1, and literacy. So since they are considering infant mortality rate, they are taking life expectancy at the age of 1 and literacy, right? Economic development indexes, income, education and employment. Human poverty indexes, life expectancy, literacy and access to basic services. So what is the correct option? It is HDI, right? So HDI, what is the mnemonic to remember HDI? Kill, right? This we have discussed. Knowledge, that is mean years of schooling, income, GNP, L is life expectancy at birth. So kill, B. Physical quality of life index, what is the mnemonic? Ill, right? Infant mortality, life expectancy at the age of 1 and literacy. So this you could easily rule out. So the correct option is human development index, and I hope you mark this. Moving on to the next question, again from indicators of health. Which of the following indicators are used to measure the physical quality of life index? Again, just now we discussed what is physical quality of life index. Life expectancy at the age of 1, literacy, infant mortality rate. So multiple options can be correct in this particular question. Only one is correct, that is life expectancy at the age of 1. 1 and 2 are correct, all are correct, none of them are correct. So what is the correct option? All are correct. Moving on to the next topic, disaster management. Of course, you already know that disaster is also given very much importance in NEET exams especially. So, and there are 2 questions from this particular topic. Which of the following is not a phase in the recovery phase of disaster management? Okay. Response, rehabilitation, reconstruction, preparedness. So, what is the correct answer for this? Response, rehabilitation, reconstruction is done in the recovery phase. Preparedness and mitigation is done in the risk reduction phase, that is before the occurrence of the disaster, right? So preparedness and mitigation is done in the risk reduction phase. Whereas these 3 are done in, that is response, rehabilitation, reconstruction, are done in the recovery phase. What is the correct sequence of steps in disaster management? Okay, so when there is an impact, okay, disaster hits, then there is response, correct, then you do rehabilitation, then you can do preparedness and mitigation, correct. So what is a recent disaster which has happened in our country? Wayanad, right? Kerala state. So the correct order is which one? Impact, response, rehabilitation and mitigation. So option D is the correct answer. Alright. Coming to demographic cycle. Okay. Which of the following correctly represents the stages of demographic transition model in the correct order? Okay, again we have discussed this. So what is the first stage? High stationary, correct? In high stationary, what happens? Both birth rate, this is very, very important, and death rate are high. The next one is early expanding. In this, birth rate is not changed, okay, it remains unchanged, but death rate starts to decline. What happens in late expanding? Birth rate starts to decline, death rate declines further. Alright, so these two only you should understand. The other three are simple. The fourth stage is low stationary. In this, birth rate is low, death rate is also low. The last phase is declining. In this, birth rate is only less than death rate, right? This is what you need to understand. We have read this. So they've asked the correct order here. The first one is high stationary, second one is early expanding, third phase is late expanding, fourth phase is low stationary, and the fifth phase is declining. So what is the correct option here? The first one, right? High stationary, early expanding, late expanding, low stationary, and declining. So there was one more question from demographic cycle in PG 2024. So what was this question? Identify the marked structure. So this particular structure in purple line was marked. We were supposed to guess it, right? Whether it is a birth rate, death rate, etc. So what is this? Is it birth rate or death rate? So let us revise the demographic cycle stages. Then you will only get the answer. So what is the first stage? High stationary, right? In case of high stationary, what is there? Birth rate and death rate both are high. Okay. What is low stationary? Which is the fourth stage. Birth rate and death rate both are low. What is declining? Birth rate is less than death rate. What is the second stage? Early expanding. Right? And the third stage is late expanding. What happens in early expanding? Birth rate is not changed, but death rate tends to decline. In case of late expanding, birth rate declines, death rate further declines, right? In second stage only that started declining. So what is happening here? If you see the pink line, in the phase 1, in the phase 2 it is not changed much. In the phase 1 it is high, of course, but in the phase 2 it is not changed. But if you look at the purple line, in the phase 1 it is not changed or it is high, but in the second stage it is declining, right? So what is this then? Is it birth rate or death rate? So it is death rate. So the correct answer for this is death rate. So the marked structure indicates death rate. So that is how you are supposed to answer this question. Moving on to the next topic, that is from environment and health. So that given this image, right, of an instrument, we were supposed to guess the instrument's name plus tell what it is used to measure, right? So what is this instrument? Is it kata thermometer, sling psychrometer, or globe thermometer? So the correct answer is kata thermometer. And the kata thermometer is used to measure cooling power, correct? So I hope you have marked this correctly. We have discussed this. Radiant heat is measured by globe thermometer. Air movement is anemometer, right? And humidity is hygrometer or sling psychrometer. So this is Kata thermometer and it is used to measure cooling power. That is the correct answer. Moving on to epidemiology. In this, they've asked the correct sequence of steps in conducting a case control study. Again, case control study we've discussed, right? And if I've repeatedly told you, if we understand case control study, its methodology, its design, it is easier to understand all the other study designs. So case control study is given very much importance. And in this exam also, that is NEET PG 2024, this particular topic was asked. So what are the steps in conducting a case control study? So whenever such a question comes, I want you all to recall the steps, then look at the options. Otherwise, it gets confusing. So what do you do in a case control study first? First, we select the cases, right? Select cases. Then we select controls. So while selecting controls only and cases only, what do? Matching, right? What is matching? The controls are similar to cases with respect to certain basic characteristics, right? Like age, gender. After the selection is complete, we are going to do measurement of exposure in each group, right? That is cases group and control group. And then we are going to do the analysis. Okay, calculate odds ratio, etc. So this is the correct sequence. So which is the correct option here? Selecting cases, selecting controls, matching, measurement of exposure and analysis. So option C is the correct sequence of steps while conducting a case control study. Moving on to vaccines. Again, vaccines every year at least there will be 1 or 2 questions, right? Which of the following vaccines is kept in the bottom of the ice-lined refrigerator, right? It is not the front load refrigerator they've asked, it is the ice-lined refrigerator. So what do you keep at the bottom? So ice-lined refrigerator, what is the temperature at the bottom? It is very cold, right? So heat sensitive vaccines should be kept at the bottom. So what is it? Is it polio, hepatitis B, rotavirus or DPT? What are the heat sensitive vaccines? It is polio. The most heat sensitive vaccine is polio. So the correct answer is this. So what are the vaccines? What are the other vaccines which are kept at the bottom of the ice-lined refrigerator along with OPV or just above OPV? You can keep BCG and measles, right? Okay, rotavirus is above that and all the hepatitis B, DPT, that is T series vaccines come above that, right? So at the bottom of the ice-lined refrigerator, you're going to keep the polio vaccine, okay? So another question from vaccines was about cholera vaccines. Which of the following is true about cholera vaccine? Monovalent vaccine given at day 1 and day 7th. Bivalent vaccine given at day 1 and day 7th. Monovalent single dose, bivalent single dose. For this, let us understand the cholera vaccines first. So basically, there are 3 types of vaccines which are in use currently. Dukoral, Sancol, UV-Col, right? So Dukoral is the commonly used vaccine. It's a monovalent vaccine. It's a heat-killed vaccine plus a subunit vaccine. It has cholera toxin also. So whole cells of Vibrio cholerae plus recombinant cholera toxin subunit is used here, right? 2 oral doses. Coming to the schedule and the dosage, 2 oral doses 7 days apart should be given, but it should be less than 6 weeks apart. It can be more than 7 days apart, but it should be less than 6 weeks apart for adults and children aged more than 7 years. 3 doses for 2 to 5 year age children. Less than 2 years, we cannot give this vaccine. And for both the groups, that is adults and children, booster doses are required. So Dukoral is monovalent, 2 doses for adults, 3 doses for children, right? Sancol is bivalent, that is O1 and O139 both are here. 2 doses 14 days apart. So it's bivalent and 2 doses. Boost is given every 2 years. UV-Col is similar to Sancol. So the commonly used one we can go with, that is Dukoral, which is monovalent and 2 doses for the adults, right? So the option can be monovalent given on day 1 and day 7th. So that can be your correct answer. Moving on to a question from clinical trial. Again, in the Faculty Connect videos, we have discussed this, right? Phases of clinical trial. In which phase of a clinical trial is the correct dosage of a drug typically evaluated? Is it 1, 2, 3, 4? So let us look at the phases first. So phase 0 is what? 10 to 15 healthy volunteers are taken. Testing, what do we do here? Testing if a drug engages its expected target, right? Phase 1, we do it among 10 to 100 healthy volunteers or diseased volunteers. This is for safety evaluation. We study common side effects and also toxicity profile, right? So in phase 1, we see if there are any side effects, what is the highest dosage we can give. So usually we study about dosages in phase 1. Phase 2, 100 to 1000 diseased individuals. Here we study the safety and efficacy of the drug. Phase 3, 1000 to 3000 diseased population. This is the final confirmation on efficacy. So once phase 3 is clear, it goes into the market, right? Phase 4 is post-marketing surveillance. So where do you study the drug dosage, toxicity profile, common side effects, highest dose which can be given? It is phase 1. So the correct answer is phase 1. All right. Now, another question was longevity dividend. So we have not discussed this. This is an unexpected question. What does the term longevity dividend refer to? So first of all, what is longevity dividend? Okay, is it the decrease in the healthcare costs due to longer life expectancy? The economic and social benefits that arise from increased life expectancy? The reduction in the retirement age because of improved health? The increased cost of living due to aging population. So all you need to know is what is longevity dividend. So it is the economic and social benefits which are gained because of increased life expectancy, because of decrease in the number of deaths, because of decrease in the number of comorbidities, right? Because of increase in healthcare in the country, we are having economic and social benefits. That is what is longevity dividend. All right, because of decrease in the number of deaths and also decrease in the number of comorbidities because of increased availability of healthcare. Okay. Coming to infectious disease epidemiology, there were two questions on definitions. Again, we have discussed this. The time interval between entry of organism to development of first sign or symptom is known as incubation period, period of communicability, generation time, latent period. So latent period is the time interval between the disease onset to detection of symptoms. So this term we use in case of non-communicable diseases. So what is generation time? Receipt of infection to maximal infectivity. Okay, infection to, that is entry of infection to maximum infectivity in the body. So what is period of communicability? The period during which the disease is communicable to others, contagious to others. So what is incubation period? It is the time interval between the entry of organism to development of first sign or symptom, right? So the correct answer is incubation period. So simple question, right? Moving on to another question from infectious disease epidemiology. If the incubation period for a disease that has a potential to be a pandemic is 10 days, what should be the quarantine period? All right, so we need to understand two terminologies, isolation and quarantine, right? What is isolation? And what is quarantine? Isolation is the person is already having the disease, okay? He is a diseased individual already. Whereas quarantine is apparently healthy. He might be exposed, but he is apparently healthy, right? So isolation is for what period? It is for the period of communicability, right? We don't want the infection to spread to others. What is quarantine? It is for the, it is longer than the longer incubation period. So for a disease, if it is 10 to 14 days, if the incubation period for a disease is 10 to 14 days, so the quarantine should be more than 14 days, okay? Longer than the longer incubation period. Okay, so for a disease, it is 10 days. So what should be the quarantine period? Is it shorter than 10 days, equal to 10 days, or longer than 10 days? So the correct answer is longer than 10 days. Moving on to a question which was from entomology. The question was like this, the scenario was like this. A female from Bihar presents with dark pigmentation, fever, and hepatosplenomegaly. Which vector is responsible for transmitting this disease? All right, dark pigmentation. So the minute you see this, you should arrive at the diagnosis. So what is the diagnosis here? Kala Azar, right? There is hepatosplenomegaly also. So which vector is responsible for transmitting this disease? So mosquitoes, we can safely rule out. They are not involved in the transmission of Kala Azar. So is it tsetse fly or female sandfly, right? The confusion is between these two options. Tsetse fly is sleeping sickness. Again, I've repeatedly told you entomology is very important. The vectors involved in transmission of different diseases. Every year at least there'll be one question. And the sandfly transmits Kala Azar. So the correct answer is female sandfly. Coming to food adulteration, fortunately we have discussed this also. Which of the following tests is considered most sensitive for detecting food adulteration? Is it gas chromatography, mass spectrometry, enzyme-linked immunosorbent assay, paper chromatography, nitric acid test, right? So these two we can easily rule out, right? Paper chromatography and nitric acid test. These are the tests commonly used for food adulteration. So out of these two tests, which is the most sensitive test? So it is the paper chromatography test, which is the most sensitive test to detect food adulteration. So this we had discussed while discussing epidemic dropsy, right? So this is a snapshot from my notes, which is there in Manipal MedAce app. So paper chromatography test is the most sensitive test yet devised, right? So if we had remembered this, we could have marked it correctly, and I'm sure you've all marked this answer correctly. So with this, I've come to the end of the session. I think we've discussed some 36 to 38 questions in this recall session. And most of the questions, at least 95% of the questions, are direct picks from our notes, videos, recall sessions, right? And the Faculty Connect videos. The special feature of Manipal MedAce app is there are various types of tests, subject-wise tests, periodic revision tests, right? Mock tests. They're very, very useful. So please subscribe and happy learning. Thank you.